Hello everybody, I am Dr. Previn Poddar. I am a former head of Department of Molecular Medicine and Biology at Jaslok Hospital Research Center, Mumbai, India. Today I am going to talk on our special issue on immunotherapy of cancer, which is published by Journal of Cancer Metastatic and Treatment in 2021. I am fortunate that I am a guest editor of this special issue, and I am thankful to the journal for giving me this opportunity. As you all know that the global burden of cancer is almost about 20 million people, and about 10 million people are dying with the cancer, showing that there is a high about 50% mortality rate. Therefore, the major cause of the death is due to the high toxicity of the chemotherapeutic drug resistance developed by cancer cells. Therefore, there is a need to find out appropriate therapy for cancer which can only kill cancer cells and reduce drug toxicity. Immunotherapy is an alternative therapy for cancer which mainly boosts immune response of the cancer patient, and kill cancer cells alone with a fewer side effect. In 2018, Professor James Allison from MD Anderson Cancer Center, USA, and Dr. Hange from Japan received the Nobel Prize for his outstanding contribution to the field of immunotherapy. Since their discovery, there is an great excitement in the field of cancer medicine to find out an appropriate treatment for the metastatic cancer by using immunomodulators. There are 4 different types of immunotherapies. One is monoclonal antibody. Second is use of immunocheckpoint inhibitors. Third is cancer vaccines. And fourth is chimeric antigen receptor cell T cell therapy called CAR T cell therapy. Presently, immunotherapy is given in combination with mild dose of chemotherapy to get effective and have the non-toxic treatment to most of these cancer patients. Immunotechnology in the field of cancer medicine and cell biology, it becomes easier for us to understand the human immune system. Similarly, there is an extensive program planned to discover small molecules, peptides, recombinant antibody, vaccines, and cellular therapies which can help to manipulate the immune response of the cancer patient for the cure of metastatic cancer. In this special issue of immunotherapy of cancer, we have included original articles from some of the pioneer scientists and clinicians from all over the world working in this field. Dr. Gadichon et al. From Lyon, France, has explained that there is a great improvement in the cure of squamous cell carcinoma of head and neck cancer by using various checkpoint inhibitors or small molecules such as PD-1 and PD-L1 inhibitors. Similarly, Spector et al. From the University of Michigan, USA, have reviewed most of the common destructive checkpoint inhibitors used in head and neck cancer, which can target the tumor immunomicroenvironment for cure of metastatic cancer. Jagalska et al. From Leiden University, Netherlands, have demonstrated that targeting CXCR4 signaling pathway in the tumor microenvironment for the treatment of metastatic cancer by using one of the zebrafish experimental model. We have included one of the important paper by Professor Giovanni from Italy, who has documented his experience in walking therapy helps the young inoperable patients for pancreatic duct adenocarcinoma to increase survival rate by boosting his immunity through his exercise. It is known that triple negative breast cancer and prostate cancers are difficult to treat by conventional therapies. However, Professor Matthew from UNT Health Center, Texas, has shown that there is higher expression of LLT1 on the triple negative breast cancer cells and prostate cancer cells can be inhibited by respective antibodies, which can offer a potential target for breast and prostate cancer treatment. One of the articles I have included in the special issue is from Professor Webster from Feinberg School of Medicine, USA, who has developed the atom library called Functional Assessment of Chronic Illness Therapy, called FACIT atom library, having a data from cancer patient who has reported adverse event associated immunocheckpoint modulators. Thus, this FACIT atom library will be great reference for clinicians to be used for clinical research evaluation of respective checkpoint inhibitors in their clinical practice. As you know that EBV associated gastric cancer is a common characteristic by high lymphocytic infiltration in the tumor microenvironment coupled with overexpression of immunogenic checkpoint related genes such as one is programmed death ligand, that is PDL1 gene. So Professor Frank Slack from Harvard Medical School has highlighted that EBV associated gastric cancer is a strong candidate for immunocheckpoint blockade therapy after proper research in this area. So overall, I have to state here that this special issue on immunotherapy of cancer has included a number of original research articles, clinical studies, and systemic reviews of cancer immunotherapy from different angles from various distinguished scientists and clinicians from prime institute and medical centers all over the world. I am sure that this special issue can provide valuable information to the most cancer researcher, clinician, and academic professor for the enhancement of knowledge in the field of immunotherapy for better cure of metastatic cancer. Thank you very much.